Stay tuned as Kansas City Live continues. Next, brace yourself. Dr. Buford Casebolt will tell us about the world of orthodontics. If you have questions, get your calls ready at 241-7720.
Hello, this is Dr. Casebolt, and this is Dentistry and You. Tonight, I want to talk about a very, very important subject, orthodontia. And with me is Dr. Dean Dyer. How do you do, sir?
Good evening.
Great. You know, orthodontia is a very important thing to me. As a young person, I had orthodontia in my own mouth, and it made the most important difference in the way that my teeth were as opposed to the way they are now. And I have to say and give the greatest congratulations to an orthodontist by the name of Dr. Richard Radke. I think we know Dr. Radke.
Yes, we do.
He was the orthodontist that did the services for me. Orthodontia, again, is the most important part of dental treatment. It is the ability to go from what is genetically imposed. Is that the right term?
Well, that's a big part of it, is genetics.
Perhaps genetically imposed, or perhaps imposed upon a person from other, I don't know, how shall we say, the person who used a pacifier for too long, the person who had a traumatic accident, any other aspects of dentistry or trauma or genetics that resulted in the need for orthodontic treatment. And again, as an orthodontist, this is one of the things that you address for our patients. And again, I want to welcome you to Kansas City Live, Dr. Dyer. I see we have a tremendous amount of cases here, and I was just absolutely amazed at what we had here to offer. I think to start with, first of all, for our public that doesn't know a whole lot about dentistry involving orthodontia, I thought we might look at the particular case here. This is a case involving full-banded orthodontia. What can you tell our public at home in terms of what we see right here?
Well, these are just examples of different appliances. What you see on the upper teeth are appliances that were used up until maybe 10 years ago, and probably what you had when you had your braces done.
I see.
And there are full bands around all the teeth. And if you opened it just a little bit, you could see the lower teeth. And these are a newer variety of the same type of appliance, except the brackets actually bond or glue to the front of the teeth. So you do not have the metal band all the way around. You know, there's some advantages and disadvantages to each.
You know, that is a major difference. When I had orthodontia in my mouth, I had full bands around every single tooth, front and back, without question.
Right.
This was necessary for the treatment at the time. However, a lot of the young people today that are having orthodontia are having orthodontia done in such a way that we don't have to have full bands around the teeth. And as I understand, and this is an important fact, that we no longer have to have the long period of time to close the gaps between the teeth because there were bands there. There are brackets that are bonded to the tooth structure, and not bands that go all the way around the tooth, but just simply brackets that are bonded right to the tooth structure so that the teeth are actually in contact during the actual orthodontic procedure.
That's correct.
Now, that is a tremendous advantage, isn't it?
That's right. It's also an advantage when you start your treatment. You'll probably remember you had some things between your teeth to actually move them apart a little bit so that those bands could be placed. And today we don't need to do that except in the back. We still use those heavy metal bands in the back because they are stronger, and that's where the pressure is, where you do most of your chewing. But in the front, we no longer need those spacers or separators, and they're very uncomfortable for the first day probably. Kids will, and adults too, may want to eat some softer foods during those periods of time. But today, since we don't need the spacers, it's really much easier to place the appliances. Easier for us and easier for the patients too.
You know, I think that's tremendous. You know, orthodontic treatment is probably one of the greatest, most incredible treatment that we can offer for young people, and maybe not quite so young people anymore. You know, there was always a stigma that you had to have orthodontic treatment, braces, when you were between the ages of 13 and 20. But that's not true anymore, is it?
No, it's not. We have many, many adult patients. As we were talking earlier, probably the oldest patient I had was 72. We just finished this lady a year ago, and she was just tickled to death with the results that we achieved. So probably 40% of our practice today is with adult patients.
Well, I also wanted to say to our people at home, this is a call-in segment. If you have a question for either myself, Dr. Casebolt, or Dr. Dyer, please give us a call. The phone number will occur at the bottom of your screen. If you have a question about orthodontic treatment, either for yourself or for your children or for someone that you know, just give us a call. By gollies, we'd love to hear from you. You know, Dr. Dyer, there are a lot of things here that, gosh, we could talk for hours. I mean,
that's right.
This is just absolutely phenomenal. There was one case that I wanted to go over that I thought was absolutely fascinating from very beginning to end. Now, if you'll help me, I believe these were the initial ones.
Yes, that's correct.
And I'll go ahead and articulate them so that the people at home can see exactly what this patient looked like. Now, this patient looked, let me see, here we go.
That's correct.
Looked like this. Now, tell the people at home exactly what we're seeing.
Well, there's a certain way that Mother Nature designed our teeth to fit together, and these are completely off of where they should be. The upper teeth on this side are totally outside of the lower teeth rather than fitting down on top, and you can see in the front there's quite a retrusion of the lower jaw. In other words, the upper jaw may be a little bit too far out, the lower jaw too far back. So there are many discrepancies in this adult, and those discrepancies were causing many problems, not only an appearance or aesthetic problem, but also a periodontal, which means gum problem. The supporting structures of the teeth were being affected, and he was losing the bone around the teeth because of this malocclusion.
You know, there's some pretty serious problems here. First of all, not only do we have periodontal problems, and I've talked about this in previous programs, but also the teeth over on this side, on the left side of the screen, are such that they are completely overlapped with the lower teeth. This is a major problem.
It really is.
This person had a major problem. Not only that, as I look here, there is no home base.
No.
In other words, I can't find a place to articulate these teeth together.
No, not at all.
This patient has a problem.
Yes, very definitely, and it was causing severe problems. And it was something that a few years ago we were really not able to handle it effectively. But today, with the use of orthognathic surgery, that's a big term, but it means jaw surgery that is helpful in placing the teeth and the jaws in the proper position. We're able to correct malocclusions like that.
What kind of surgery was required prior to the orthodontic treatment that was necessary here?
Interestingly, when we do these type cases, we do the orthodontic treatment first, and then the surgery follows that. And the reason is that we align the teeth, and then when the surgeons do the actual operation, the teeth then fit together properly. So we had braces or orthodontic appliances on him for a period of time, and the front teeth were ultimately going to be lost because of lack of bone support.
I see.
But we retained them during the treatment period just to help fasten the orthodontic appliance. So the orthodontic was completed, the orthodontic treatment, and then the oral surgeon actually cut the lower jaw and moved it forward. And the interesting part of this one is, you remember, the upper jaw was too wide to fit with the lower. So they cut the upper jaw loose and then took a strip of bone about so wide right down the middle of the top of the mouth so that the upper teeth could be moved together in the back.
That is absolutely amazing.
Then it's all wired and it heals and so on.
I'm going to go ahead and prompt our camera person to the model that we have here. This model now represents the removal of the upper front teeth, which were considered to be hopeless at the time. One thing that I've noticed about this, doctor, is that the teeth are a little bit more firm. In other words, I find a point of a little bit more home base.
That's right.
That is sort of a slang term, and I hate to use slang terms, but what the heck. It's the only way that we can get this point across to the people at home. There is a point where these teeth come together.
That's correct.
even though it is true that we are missing the teeth here, the teeth come together in a more basic home base position.
That's right.
Now, this is after the surgery, after the removal of the front teeth.
That's correct.
Now, where are we at this point in the treatment?
Well, at this point, he was wearing a retainer with some false teeth to fill in the space and make it look, the appearance normal. And after the remaining teeth are stabilized for a few months, then he's referred to his general dentist for placement of a permanent bridge. And I believe we have a model there showing the treatment result when this permanent bridge was placed from cuspid to cuspid, commonly called the eye teeth. And the other model there is showing the end result of this.
Okay, I'll go ahead and get the other model here in just a moment. It is really amazing what is involved in the orthodontic treatment. It is a holistic approach. There's not just one single practitioner involved. In fact, in the most difficult of cases, it involves a team approach.
That's
where
correct.
Many practitioners, whether they be oral surgeons, maxillofacial surgeons, orthodontists, general practitioners,
That's right.
whoever is involved with this is definitely, and I most importantly must say, a definite team approach. And I want to show this last set of casts, and this is absolutely amazing. And if we could prompt again our camera here to this set of casts, take a look. We have a fixed set of bridge work. It looks beautiful. I can articulate the teeth like this, and it feels normal.
We have very
This
good
is
function with
amazing.
them. Well,
This
it
is absolutely amazing from where we went from the first set of casts, where we absolutely had no point of occlusion, to the point where we have a fixed bridge across here, and we have teeth that are in fact functioning properly and probably have an exceptionally good aesthetic case.
That's right.
That is amazing.
And longevity.
Yes.
The object, too, was to help him retain the teeth. And I think that's been accomplished in this case. It was a fun case to do. It involved many people: the oral surgeon, the endodontist, the one that does root canals, the periodontist to treat the gum disease, the general dentist, the orthodontist, and so on. So it was an extensive thing. It takes a lot of time and coordination between all these people to work it out. But the patient was very appreciative, and we're very pleased with the results.
How old was this patient when they began treatment?
Mid-40s. It was an adult male, mid-40s.
That's quite amazing. How long did the treatment take total?
Approximately 2 years.
Only 2 years?
Yes.
I'd say that patient got a tremendous treatment regimen.
Well, we feel
that's
so.
just amazing.
We really feel so.
Yeah, that is fantastic.
Yeah. It's very pleasing to do that type of a case.
And I wanted to say to our people at home, we're here on American Cablevision, KCCP, Channel 30. And again, I do want to make the disclaimer, we're not here to make a diagnosis for you, to solve your problems. We are here to give basic information and help for you, for your dental needs. If you have a question, any question at all about dentistry, please give us a call. I'd love to hear from you. And remember, the phone number should appear at the bottom of your screen. And if you have a question for me, Dr. Casebolt, I'm a general dentist, or for Dr. Dean Dyer, an orthodontist involving orthodontic treatment, for gosh sakes, give us a call. Well, doctor, going further ahead, one of the things that I wanted to mention, and I think probably most importantly, I was looking at this cast right here, and I'll go ahead and move it forward so that we can see it. And I believe that both of these casts mate together. Is that correct?
Yes, they do.
When I had braces, and we can go ahead and put this on the screen so that the public can see this. When I had braces, everything showed metal, major amounts of metal. Everything was metal. If I had walked through a metal detector in going onto an airplane, the thing would have gone off majorly. But looky here, I can't see the metal.
Not on the lower.
These are plastic retainers.
Well, there are two types available. One is plastic and the other one is ceramic. This particular one happens to be ceramic, and it's difficult to tell them apart on a demonstration model such as this. But the ceramic holds its color. in use, whereas the plastic sometimes discolors. There are pros and cons for each method, and of course on the upper you still see the metal. One of the latest things now that the kids are all asking for are the little colored ties. You'll see different colors there. And we try to make the appliances more inconspicuous, and the kids want them to be showing up. So they're asking for the different colors, and that's kind of a new thing. Even some of the adults are asking for them. So on the lower, you see one that tries to mask the appliance, and on the upper, they're showing it off. Times have changed.
That's interesting. You know, we couldn't even possibly stand the idea that our braces showed.
That's right.
I mean, we were I was, as a young child, no, I wasn't quite so young. I was older at the time. But the thing is that when I went through orthodontic treatment, I mean, I was very self-conscious about it. I had the darn appliances on. They hurt a little bit. I mean, I'll be honest with you.
Occasionally.
They had to be torqued. Movement had to be done with the teeth. And I went around, and they hurt, and everybody said, you got braces on. Now, isn't
no
that
longer
interesting?
the case.
Isn't that interesting now that it has become socially acceptable? We're talking 20 years now.
Well, that's true, but I think people are more conscious of taking care of their teeth and retaining their teeth than they were 20, 30 years ago. When I first started, it was true. Kids would tease each other.
Yes.
The junior high kids were probably the most, the biggest problem with teasing each other. But today, it's a thing that the kids say, well, when do I get them? Isn't it time yet? And so on. But the general public, I think, has more of appreciation for keeping their teeth and retaining them for a lifetime. 20 years ago, they didn't quite have this idea. For instance, when I was growing up, felt like when I got to be 40 years old, you'd have false teeth. That's no longer true. So all the specialties, and particularly orthodontics, is a help in keeping your teeth.
I think that's fantastic. I have time for a phone call, a brief phone call. If you wish to talk with either myself, Dr. Casebolt, or Dr. Dean Dyer, our orthodontist here in Kansas City, please give us a call, and give us a call very soon, because we are running out of time, and we'd certainly like to hear from you. Doctor, with the treatment of orthodontia, and I suppose you deal with children. Well, I don't want to say children, I want to say young adults. Maybe that's probably
We have all
better.
ages. We've had them from 3 years of age to correct a crossbite up to the lady that was 72. So we have quite a broad range.
What is the most fulfilling part of your treatment regimen? What fulfills you most more than anything else?
I think the thing that really is fun is to see the people change.
Yes.
Their self-image improves, and parents may not see this with their children because they see them every day and may not notice it, but we see them approximately once a month, and you really can tell the difference. They come in, they're kind of timid and hang their head, and they're quiet, and as the teeth begin to straighten out, they change their own self-image, and by the time they're finished, we kind of think of it as they just sort of blossom. That's fun. It's fun to see these people change and become more self-confident. It's a big part of it.
You know, that is absolutely fantastic, and I think upon the pictures that I had of myself before I had orthodontic treatment and the pictures that I had afterwards, and I look at the great advantage that I got out of the treatment that I received, and I can only think, oh, what a wonderful procedure that you do for the public. And Dr. Dyer, I really appreciate having you come on Kansas City Alive and Dentistry and You, my segment. And again, I want to thank all of those people for watching Kansas City Alive, KCCP TV 30. In 2 weeks, I will have another individual, Dr. Bob Usetti, involving ambulatory dentistry. And again, I want to thank you very much for watching Kansas City Alive.
Stay tuned as Kansas City Alive continues. Next, Dr. Buford Casebolt will talk about implant dentistry on Dentistry and You. If you have any questions, get your calls ready at 241-7720.
We're here to roast the barons of buckling up. Two guys have lost more limbs than a tree surgeon, Vince and Larry.
I love these guys. They remind me of my husband, always broken in a dead-end job.
By getting people to buckle up, they've saved thousands of lives. On the job, what's the first thing that goes through their heads? The steering wheel! Vince and Larry, Hey, tell me, how do you want your coffee? Regular or decapitated?
Everybody give him a hand.
You could learn a lot from a dummy. Buckle your safety belt.